So can EMDR be done virtually? The short answer is yes. So the way that we have been doing therapy the past week or so has been changing dramatically thanks to the coronavirus. So in order to do EMDR virtually, there's a couple things that you have to know to be able to do it. One, you have to make sure that you have a HIPAA compliant telehealth system. I know that some of the regulations have been removed for a lot of HIPAA compliance. They're not as strict with it because of what's going on. However, I think it's great for clients, especially when you're doing intense trauma work, just to reassure them that you have a secure system that is safe. So I personally use Simple Practice. I love it. It's super effective, super easy. We could chat more about it if anybody wants to know, but I use that. One of the reasons why I love Simple Practice is they have the screen share option. So this is going to be super helpful when you're doing EMDR because you can pull up a light bar either on YouTube, or there's actually an app on the Mac store called EMDR, and you could pull that up on your screen, do a screen share, and then the client can actually use that to do phase 4 of EMDR, which is the reprocessing. If you don't have the screen share option, you can also guide your clients in the use of the butterfly hug. So what does that look like? Cross one arm here, and then just teach them how to tap, and you're going to guide them. You're going to say, okay, just tap yourself if you're doing phase 4, tap yourself quickly, notice what's coming up. If you're doing resourcing, phase 2, you're going to tap slower, shorter sets. So the butterfly hug is a really useful tool. The other option, if you prefer eye movements with your clients, is you can have them glance at the corners of the room. So what does that look like? You're gonna go over their target, and then you're just gonna say, okay, notice that, and then look. Just notice the corners of the room. And it has the same effect. They're still doing the eye movements. If you need to change the speed or the direction, you can guide them with your voice. So just look a little faster. You could slow it down. You always want to, as an EMDR therapist, pay attention to their affect, what's coming up as you're processing. And that's pretty much it. It's a great way to do EMDR if you can't get your clients in the office. With everything going on now, it's good to have another way to treat our clients so that they could still get the help they need, and we don't have to stop all the work we've been doing because of what's going on. So just to remind everybody, this was for phase 4 of EMDR, a little bit of phase 2. But with EMDRs, everybody knows, just a little disclaimer, always make sure it's a good fit for your client before you're jumping into it. Always make sure you go through each phase, the 8 phases of EMDR, slowly and surely. And if anybody has any questions about anything, I am an EMDR consultant in training, so I'm offering low-cost consultations to anybody who is interested. 5 of the hours with me count towards the 20-hour requirement for your EMDR certification. So if you're interested, shout me a holler, and I'm here if anyone needs anything. Bye.